we're talking about motherhood. Moms know, you're all going to want kids after you see this. Moms know things don't quite look or feel the way they used to after having a baby, but lucky for us, why? You'll find out. You can get your body back without invasive surgery and weeks of recovery. And this week's Keeping Up with Kristine, I take a look at the latest and easiest mommy makeover treatments. Cool.
Keeping Up with Kristine. Stay in the know on the go.
Mommy makeover, not a new term, but there are some new techniques. As a new mom, I'm so interested to learn about these. Dr. Kevin Smith with Charlotte Plastic Surgery. Good morning.
Good morning.
So glad you're able to talk about what I've been going through as a new mom. And first up, the droopiness, loss of volume after breastfeeding my son for a year.
Yeah, that's very common. One of the most common things that are asked to us by patients. And with breastfeeding changes, the breast gets smaller, the breast gets droopy, so we can treat that with sometimes augmentation, sometimes with a lift, sometimes with both.
And downtime really varies on what you decide to do.
It does. With breast augmentation, a long weekend is really pretty reasonable. You have to be a little careful with lifting, but it's a fairly quick turnaround procedure.
Soft tummy, that's something that happens after baby.
Oh, there's no going back after that big stretch. And now we have new techniques that really make this much different than what we used to. With injectables, an anesthetic that lasts for 3 days, that really helps patients get through without much narcotic. Most are off of pain pills by 4 or 5 days. So that allows you to be up and moving. And then now with the techniques where we put in stitches to eliminate the need for drain tubes, that's another hindrance that slows down that recovery period.
The sooner we can get in the carpool lane, the better.
And usually it's about a week.
Perfect. I don't know how to say this except maybe the pelvic floor takes a beating.
It does, but after that stretch, it, like the tummy, doesn't shrink back. So we now have a device called Thermiva that's a radio frequency device that imparts energy to help shrink and tighten that pelvic floor, to restore the mucous membranes and make things closer to normal, to take care of that little bit of stress incontinence that can happen after having a baby.
So I can sneeze and do a jumping jack without needing a pad.
We hope so, exactly.
That's nice, and no surgery.
And no surgery.
How long after baby should we be waiting to do these procedures?
It really takes about 6 months for the tummy to shrink back, and then it's probably a good idea to wait 3 to 4 months after finishing breastfeeding before we address the breasts.
Dr. Kevin Smith, thank you so much. Great techniques here at Charlotte Plastic